Okay, now we're ready to talk about the lymphatic trunks. So here would be some of the lymphatics within the thoracic region, but I want to go directly to what we call the lymphatic trunks. The lymphatic trunks, collecting vessels, coalesce to form the lymphatic trunks. There are several trunks, and basically what they're doing is the coalescence of these vessels to handle the arms, the legs, the head, and so forth and so on. So the major lymphatic trunks are going to be the paired lumbar ones. So we're going to start with the lumbar. Here's a picture. Here would be the lumbar trunks up in here that's draining the legs. Okay, that's the lumbar. The subclavian trunks, I'll go to that next. The subclavian trunks would be here draining the two arms, the subclavian trunks. So going back, the legs are being drained by the lumbar, the arms by the subclavian. We go back. The jugular trunks. The jugular trunks are draining lymph from the heads in the jugular area, jugular vein area. Okay, so the jugular, subclavian, lumbar trunks. Okay, we go back. The bronchomediastinal trunk. The bronchomediastinal trunk is draining lymph from the chest area, shall we say, from the chest area. So the bronchomediastinal trunk. Now, all of these trunks I've named are bilateral. So you would have a right jugular, a left jugular, a right subclavian, a left subclavian. Okay? Right and left bronchomediastinal, right and left lumbar. So these would be the trunks that you have. Now we get to the last one, and that is the intestinal trunk. Okay? The intestinal trunk is draining lymph from your gut, shall we say. Draining lymph from the small intestine primarily. Now, what's happening there? Remember we mentioned that fat lipids go first into the lymphatics. Okay, so when they exit through the lymphatic capillaries in the GI tract, they ultimately will go to the intestinal trunk. When they go to the intestinal trunk, then a lot of white lipid stuff will get in that you call chyle. So immediately when that enters, it forms something I want you to read on called the cisternae chyli. The cisternae chyli. Now Latin is a good course to take to understand some clinical and scientific terms. Cisternae means box or chest. So the cisternae chyli, which is draining from the intestinal tract, is a box containing this white fat, this cisternae chyli. Okay, please read on that. All right, so this again, lumbar trunks, subclavian trunks, jugular trunks, bronchomediastinal, and then we come to the intestinal trunk. All right, we go further. The lymphatic ducts. Okay. All of the lymph ultimately enters into two ducts. One duct is called the right lymphatic duct. Let me go here. The right lymphatic duct is a duct right on the right side up in the shoulder, and that particular lymph will dump into the right subclavian vein. The right subclavian vein. Enters the right subclavian vein. Now, what's it draining? This particular duct here is draining from the right jugular, the right subclavian, and the right bronchomediastinal. The right head, the right arm, and the right bronchomediastinal. And then all of that is going into the right subclavian vein. Okay? Go to the next one. The thoracic duct. That's the big boy. That's the big boy. The thoracic duct is is obtaining drainage from the two legs, the two lumbar, from the cisternae chyli, all of the fat is going in there, from the left subclavian, from the left jugular, and from the left bronchomediastinal. So as you can see in this picture here, is getting around 3/4 of the body coming into that one. So if that got inadvertently cut in surgery, it would be severe trouble. Here, yes too, but it's only draining a little bit. So the thoracic duct is a very important structure. Okay, we go further. So lymph transport, those lymphatic vessels are weak. So what they need is pressure from vessels next to them. So as far as the superficial ones, we said the veins would kind of, their pumping action would impart, and from the arteries on the deep ones. Okay? So contractions of others help propel the blood. But remember, you have those valves, so once you propel and that contraction stops, it can't fall back the whole way. Okay? So the organization of the lymphatic system, we have the cells. Remember, the cells were like the lymphocytes, the macrophages, the reticular cells, and so forth. Then we had the tissues, which would have been the lymph follicles and the diffuse tissue. And then the organs, we had primary and secondary lymphoid organs, we mentioned. The primary being the bone marrow and the thymus. And then now would be looking at the other organs that we have. Okay? So the lymphatic system has primarily two types of lymphocytes, the T and the B. Read on it. The T cells were educated, immunocompetent in the thymus, the B in the bone marrow. We already mentioned we had macrophages, dendritic cells, and reticular cells producing reticular fibers. On the lymphatic tissue, we had the scattered type, and again, this is very redundant. They had the lymph follicles. Now, in a lymph follicle, sometimes you have a germinal center. Germinate bees to arise from. So if that lymph follicle, the lymphocytes are doing mitosis, the mitosis would be in the center here. And in a lymph follicle, you only have B cells, B lymphocytes. Okay. Here would be kind of a picture of lymphoid tissue. Now, a lymph node is a lymphatic organ. To be a lymphatic organ, you must have a connective tissue capsule around it. There are many lymph nodes in the body, many lymph nodes. So basically, this is the way the thing goes. Lymph nodes are positioned. I'm going to go back to an earlier slide here. Lymph nodes, these would be nodes, are positioned where lymphatic vessels enter into the node. And in the node would be T lymphocytes and B lymphocytes. And so material coming up that would have gotten into your lymphatics that may have bacteria or other things will be looked at by the node. So you go through the first node, then the second node, then on, because you're trying to clean everything up before you get into the bloodstream. That's the key to this whole thing, trying to clean it up. So when we go to the lymph nodes, one job they do is filtration. They have macrophages in there that attempt to destroy microorganisms. The other action is to call forth T lymphocytes or B lymphocytes that have been in some way sensitized, we'll just say until we get better, to certain antigens, foreign substances. So you're kind of shopping the foreign substance around. So inside a lymph node, let's just go. Inside a lymph node, this would be a lymph node. Here's this construct. You have a connective tissue capsule. You have vessels bringing lymphatic tissue in. So these would be afferent. Afferent means going towards the headquarters. The lymph would then percolate around. Now this area out here is called the cortex. In there, in this lymph node, you have lymph follicles. So in the follicles are B cells. So when the lymph comes in, B cells look at what's in there to see if any of these cells find something they can fight against. If they do, those cells that do start to multiply, causing the germinal center to develop. Then lymph will percolate more. Here, in this region here that we'll call a juxtamedullary region, you have a mixture of T lymphocytes and B. And then when we get further into the medulla of this right here, you only have T. So the entity is shopped around to see if anything wants to fight it. And then if not, it moves on. And then it's not through. It moves on to another lymph node. So as I alluded to, the lymph nodes are positioned along the way. That's why when sometimes you get an infection, as a physician, we'll feel your neck and see, do you have an enlarged lymph nodes, called a lymphadenopathy. A lymphadenopathy, to see if anything's enlarged. Okay? This is just to show the blood supply to the lymph node, because lymph nodes still need a blood supply. They're living entities. Okay? Again, another picture to show you, and I encourage you to study it on your own in the textbook, looking at the pictures. Here's a micrograph of it to show you this. Cortex, juxtamedullary, and the middle here is the medullary region. Okay? Here's follicles there, which would have B cells. We go now to the thymus gland. The thymus gland is a bilobed organ which is in the neck. The thymus job is to do immunocopters, to do the T lymphocytes. I want you to read on it. The thymus gland is not really two lobes. It's actually two separate deals, but the connective tissue capsule around it makes it look bilobed. It varies. You do immunocompetence early in your life. And so at that point in time, it's a fairly large organ. It's in the neck. And then as time goes on, when you're moving into teenage years, it will start to get smaller and involute, called involution. It actually goes away. It just has a little remnants of tissue. So it does all of its work early. It does all of its work very early. Okay, the thymus gland. So again, thymus most active during the youthful period. Okay. There again would be the thymus gland youthful fetus. In the adult, see, it's hardly anything. So all immunocompetence means if something happens to the thymus gland at an earlier age, you really won't have an effective T lymphocyte system, which is an important system, what we call a cell-mediated system. So the dense connective tissue holds these two parts together, which would look like two lobes, but it's really two separates. Here again is that. Here's another picture looking at that. The thymus gland has a cortex and a medulla, as you can see. Okay. The cells of so in other words, it's separated into the cortical reticular cells. So the thymus gland has something called epithelial reticular cells. They are cells that look reticular, but they're actually cells. The thymus gland has what we call the blood thymic barrier. I want you to read on. It's much like the blood-brain barrier. Its job, you don't want to get anything foreign into the thymus gland. The thymus gland is trying to educate lymphocytes, which ultimately become T lymphocytes, to know what's foreign from what's you. To know what's foreign from what's you. So if foreign stuff was to get in there, it might think foreign is you. So you have to keep it a separate entity. Okay? So read on the thymus gland. The thymus gland makes T cells, and they offer cell-mediated immunity. Here again is the thymus. So it functions strictly in T lymphocyte maturation. It has a blood thymic barrier, and the stroma, the connective tissue, consists of epithelial cells, not reticular fibers. Okay? So we'll stop here, and we'll do the spleen on another video.